And the best of the best most oftentimes are not the best. So you want to have a plan not only for your aging loved ones, but what about you? And you need to have a conversation. You need to have a real conversation with those that you love. And if you're maturing, and you need to have that conversation with those that are close to you and around you, so you can make informed decisions now while you're in your right mind and right state, so they can carry them out if something ever happens to you, or where you can't speak for yourself, be it due to mind altering things like stroke, Alzheimer's disease, and stuff like that. You need to have that conversation. So I'm getting a little bit ahead of myself, but anyway, we at Bethesda deal with the aging. Because we deal with seniors. We do visiting physician practice, where we go from house to house. We bring the doctor's practice into the home. And so, hey, Essie, thank you for joining on. Hey, Susan, thank you for joining on. Please like, invite, and share as you guys come on. And Deborah, Landy, hello, Maria. Thank you for coming on. What we do, we want to make sure that you have a plan, just like you plan for everything else. Plan for your vacation, plan to have children, plan to get married, plan have a business plan for your business. Which, by the way, business plans are considered to be obsolete now. They call them now, what do they call them? They call them business maps now. So where you are now and how you're trying to get there, and just like we talk about health mapping, that's very, very important. But you have to have a plan. So we at Bethesda Holistic Center work with a myriad of agencies that can help you with that. We work with social workers who can make an assessment of the benefits, or where the aging loved one is in regards to where they are as far as benefit concerned, as far as health insurance, life insurance, and things of that nature. I had someone to do that for my mother, and come out to find out that my mother was eligible for veteran benefits from her first husband. Figure that. But if we had not sought this person out and tried to get, to make a plan for her, we would have never found that out. So in the Metro Detroit area, there is a myriad of agencies like Area on Aging, Wayne County, Oakland County. Those are things that you can tap into to find out what resources are available to you in your area. So it is very, very important that you have a plan. I know that, guess what? We love our parents. Hopefully you do. And you want to be able to make their latter days greater than their former, but you have to have a plan for that. So at Bethesda, we help people with that. There are things that are called power of attorneys. They're for medical reasons and for financial reasons. So as a family, if you have siblings, you guys need to sit down and have a conversation. Who's going to manage what and who's going to do what? Most oftentimes in this dealing with this geriatric population, I always see is oftentimes that it always fall on one sibling or one child, or most oftentimes if it's the only child, yeah. But it could be a family of nine. I've seen a family of nine, and it falls on one, and that's not fair. I mean, if it's nine of you, you guys need to come up with a plan on how you guys are going to work together to take care of the parent, your parents. Or sometimes it may not even be your parents. It can be a grandparent, it can be an aunt, it can be a godmother, godfather. Hi, Meredith. Thank you for joining on. Hey, Joanne. Thank you for joining on. It could be a myriad of relationships to you. It may not, like I said, it may not even be a relation to you. It could be just someone that you hold near and dear to your heart, and you just find yourself in that place of helping them. So it's very, very important that you have a plan. I have someone that's close to me who had a family member that was taking care of their mother, and they were like, okay, I think I'm going to take on and have my mother to move in with me. And I was like, okay, you really need to think about that. It is different from taking care of a maturing loved one in another location, and it's totally different than when they're actually in your home. Totally different. So you have to really understand where that comes in at. So again, we work with agencies, what we call home care agencies, as a visiting physician practice. They're two separate entities, and I educate my patients on that, and I try to educate my families on that. The physician goes in and make a home care assessment based upon the environment, based upon the patient's health, based upon the patient's mobility, patient's mental cognition, to care for themselves in the home. Can they bathe themselves? Can they do their, basically daily hygiene? Can they take their own medications? Can they shop for themselves? Can they maneuver in the home safely? And we make that assessment and also come up with a plan to where we educate the patient on what is maybe best for them and best for those who are doing care for them. So that is very, very important. So once we make that initial assessment, it's not hey Deborah, thank you for coming on. Oh, thank you very much, thank you so much. So once we make that assessment, we try to hey Joanne, hey Deborah K, we try to make the assessment where you can come up with a plan in regards to how you're going to care for them in the home. Okay. um, Sometimes there is a gray area, and sometimes could be a little bit difficult, especially for those that are under the age of 65. So sometimes we have challenges finding services for that age group, like 55 to 65, because there's a lot of them that may be disabled for whatever reasons, mental, physical, whatever the case may be. And sometimes most of the resources that are out there are for 65 and older, which they call the senior population. But there are resources out there, and Bethesda Holistic Center and the agencies that we partner with help you find out what those resources are, so you just won't be out there scrambling, trying to figure out what you're going to do and how you're going to care for your loved one. So again, once we make that assessment, we try to get an agency in the home. Especially if it's first time for you, we would like to get a social worker on board. Now, I'd have to say this: all social workers are not created equal. And the reason why I say that is because they have to have knowledge about resources and what is available. So you need to really make sure that you connect with us so we can get you connected with the correct agency, connected to a good social worker, to someone that will be able to help you develop a plan and get you connected to the resources that you need, because every situation is not the same. Everyone is different. So everyone, we try to just like we say, tailor-made health mapping, tailor-made caring for your parents mapping. We try to help you with that as well too. So you got to have a plan. Are they going to live with you? Are they going to live in? And there's a difference between independent living and assisted living. There's a lot of independent living places out there that try to market themselves as assisted living, and they are not. So an independent living facility means that that person can live in that facility independent, which means that they should be able to bathe themselves, clothe themselves, feed themselves, have shop for themselves. But some independent living facilities have ancillary services on location to help with those things, but it's not an assisted living facility. Totally different. So when you are, let's say for instance, you don't want to have your parents in your home, when you're out shopping and looking for senior living facilities, you have to be educated on the difference between the two. An assisted living facility actually have the building, or should I say the company that owns the building, provide the assistance services. They don't hire an outside entity to come in. So that's the difference. You may have an independent living situation that will hire an outside independent caregivers to come in, but it's still considered independent. And what they do, you have to pay for each and every one of those services, what we call a la carte. So if you want them to bring your parents or whomever the loved one is their food, you got to pay for that. If you want them to shower, you have to pay for that. If you want them to dispense the medication, you have to pay for that. So everything is a la carte versus an assistant living facility, that is all inclusive in the cost of the stay, and they prepare the meals. In both places can prepare meals as well. So the meals are bundled into the monthly rate that you pay while you're there. So you have to be educated before you even get started on what you want for your parent. What is the budget? You have to have a budget. You have to have how much money that you are willing to spend or which is available to spend, and that will determine where the facility. And so let's just be real about it. Less money, you get what you pay for. Let me just say that. I'm gonna be nice. You just get what you pay for. So you have to have a plan. There is what we call long-term insurance now. Just like you have health insurance, disability insurance, life insurance, there's long-term care insurance now. Although, so someone like yourself, if you're not 65 or over, you can be paying for that insurance. So if you decide to live somewhere or need to get into a facility or something, you paid for it over the years, like insurance. So that is very, very important that you know about that, and that you, if that's something that needs to be in your portfolio, or as far as when you mature. You also can have what they call variable life or life insurance that you can cash out, that you can live off of, and you're not, and of course you haven't made your transition. So, and what rule book says that you can just have only one policy? You can have multiple policies to do multiple things. So in life insurance and whole life policies, so you can have one policy that you can cash out at 65 that will pay your rent. Another one for traveling. Another one for if you're into alternative services, things to pay for your natural remedies and your supplements and things of like that. So you can be creative in that, okay? But the thing is you have to have a plan now and institute that plan, and make sure that you have a conversation with family members in regards to that. So number one, educate yourself, have a plan, know your budget, what you're willing to spend and what you can spend, okay? That's very, very important. You don't want to wait until something happens to find out all this stuff, or be scrambling trying to figure it out. Example is just worst case scenario. You have a family member that has a stroke, or and they can't speak for themselves. They have a house, they have property, they might have to go into a facility for a while, and so now you're scrambling trying to find out all this information, while at the same time being concerned about the health of your loved one. So if you have that in place already, hey, this has happened, but we already have a plan. Boom, 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 right? So who is going to do the medical decision making for that person? Who is going to make sure if they want to have to go into a facility or assistant living? Who's going to take care of the finances? Who's going to pay the bills? What family member is going to be assigned to that? Who's going to do that? All that stuff needs to be in place, and Bethesda Holistic Center can help you get those things in place. Even advanced directives is very, very important at any age, from the time that you're born up until whenever. What would you want to have happen to your child, or to yourself, or to whomever, if they can't speak to themselves and they're on life support? Okay, I believe in the power of prayer. I believe in miracles. I've seen people come back from the dead. Yes, I have. But and what would you do in the instance when God doesn't decide to perform a miracle? Hey, Miss Mazine, you have to have something in writing. So you have to have an advance directive. So you have to have someone that you feel comfortable with, and someone that you trust to make medical decisions, financial decisions. Or do you want CPR? Do you want what they call everything done? which is CPR, which is cardiopulmonary resuscitation. If a person's heart stop and they stop bleeding, or do you want a DNR, which means do not resuscitate. If a person's heart stop beating, they stop breathing, they don't want anybody jumping on their chest and sticking tubes down them and sticking and all that other kind of stuff. Some people don't want that, but you have to have the conversation with your doctor and your family so it can be documented somewhere. This is what your wishes are in regards to that. So this is what I want you to do. I want you to take down this phone number. I want you to take down this phone number. It's 248-356-1111. 248-356-1111. Have a consultation with us in regards to this, okay? What you want to do for yourself or for a aging loved one or whatever the case may be. We can orchestrate your steps in that and helping you with that. What do you do when you're in a hospital and they say that you need to have home care in your home upon discharge? Guess what? You can choose an agency. You don't have to go with whom the hospital recommend. You have patient rights. You have a right to choose what agency and what doctor will follow you up afterwards after you are discharged from the hospital. One of the things with us, the Holistic Center, do we pride ourselves on. We don't try to steal people from their primary care doctor, but we fill in the gap. Because once a person is discharged from rehab or a person is discharged from the hospital, they say that they want that patient to be seen within 7 to 14 days, well, 1 to 14 days, 3 to 14 days. But sometimes with your primary care doctor, they can't see you within that time frame because they booked out 2, 4, sometimes 3 months in advance, out. So we can fill in that gap to make sure that you don't do what we call a bounce back into the hospital. We can do an assessment over the phone, what we call transitional care. We can talk to your family member or you over the phone, or actually come out and make an actual visit. And what we do is, if I can't come, we have agencies that are staffed really, really well, of nurses that can go out, make an assessment. Call me while you're in the home, or while the nurse is in the home. She calls me directly. She does not call my office staff and leave a message. She calls me directly, my cell phone, and say, "Hey, Dr. Grace, I'm in so and so's home right now. Their vitals is this. They was discharged because they were in the hospital for this, and they're home now. This is their vitals. This is what's going on with them. If even if it's wounds or whatever, they take pictures and they send it to me, and the nurse and I and the family come up with a plan before the nurse leaves the home, so the patient can be well taken care of and don't have to go back into the hospital. I've recently, within the last 2 weeks, had a lady that was discharged from the hospital with pneumonia. They found out that she had pneumonia right before she was getting ready to leave, and they were like, "You have pneumonia, here's some antibiotics." But the antibiotics they discharged her on, she was not getting better. So the nurse called me and said, "Hey, Dr. Grace, I have the so-and-so here. They was discharged home with pneumonia. She's on antibiotics and she's not getting better. What should we do?" We came up with a plan. We added another antibiotic and she was getting better. But what if she didn't have me to call? She would have waited to call her primary care doctor. Maybe she would have got through, maybe not. Or she would have had to make an appointment to go outside of the home to the primary care doctor. Okay, so you have a family member who's been discharged home that has pneumonia, somewhat lethargic, and you have to get them out the house, in the car, in the snow, on the ice, to the doctor's office to make an evaluation. That's crazy. So you need to take down this telephone number, 248-356-1111, and allow us to provide these services for you, for taking care of when people get discharged out of the hospital, or, like I said, make a plan in caring for aging loved ones. I even have some patients. I see this lady that I'm thinking of right now, who her goddaughter takes care of her. She has outlived all her siblings and all her children, and the only person that's left is her goddaughter. So we communicate with the goddaughter on a regular basis in regards to her care, and she's in a independent living that has ancillary care that that is hired to be in that building to help her. And when we go into that building, we come up with a plan with the agency, that provide the home care services, and what we call the private duty. That's what it's called, private duty in the building. Before we go in the first Tuesday of every month. We get together as a team. We send out a text. Hey, the first of the Tuesday of the month is coming. I find out what all the residents that I'm going to be seeing on that day, what their needs are. They send me a list. We talk. Once I get there, we everything that is addressed on that list, and we even talk to family. Family may come, be at the apartment or in the place where we see the patients when we get there. So communication is very, very key. So it is very, very important that you have a plan, and you need to know what resources are available to you. People perish because of lack of knowledge. The difference between the wealthy and the poor is information. So, and the difference between a healthy person and a person that is unhealthy is information and discipline to carry it out. How about that? So, we at Bethesda Holistic Center pride ourselves, godly pride, I should say, on providing you with the information that you need to care for your aging loved ones, okay? And so it is very, very important that you have a plan, especially whatever demographic area that you live in, because we are global. So we are very well versed, especially in the Metro Detroit area and in Michigan, what is available to people that are in the state. But if you're someone outside of the state and you live whatever and you still want to consult with us, we still can give you step by step on what you need to do first to make a plan if you want your parents to live with you or you're trying to get them placed into a particular facility, and what you should do and what you should look for. One of the buildings that we have been in for a while now, for maybe over 4 years now, they know, and one of their selling points, okay, if you're an assisted living or an independent living facility, one of the selling points that they use, they say, hey, we have Dr. Grace that comes out once a month. So if you can't get your parents out and if something is going on, we have a doctor that comes into the building once a month, or we have a doctor that we can call if something is going on with your family member. We do the same thing in the building that we would do in the home. If they have a fall, we send somebody out to do an x-ray. If they're complaining of chest pain or whatever, of course dial 911, or palpitations or anything that's unusual, or cough or cold or whatever the case may be, and the nurse is saying that the vitals a little bit off or they sound a little junky, and I'll say, well, junky means rattling in the chest. We can send an x-ray out. We can do EKGs, we can do echoes, we can actually do whatever what needs to be done in an office or urgent care setting in the home or in the apartment or wherever the loved one may be. We can do that. And I really am thankful and grateful for the agencies that we work with, because they are 4 stars and above. We actually have worked with these companies for a while. I vet these companies, and I thank God for these companies because they really help us take care of our patients. Okay, I have this one company. If something is really going on and I can't get there, I'll call the owner, who's a nurse, and she'll be like, Dr. Grace, I'm going myself. So they go way beyond the call of duty to do things. I have another agency that have a marketer who will, I've never seen anything like it. She takes care of the patients more than she do sometimes herself and her own family. So I have to pull a coattail. Could you go home and take care of your own mother? Could you go home and please take care of your own family? I've seen her move people from rehab into their apartments, or she really I've seen her go into her own pocket and pay for things for people. And these are the type of people that we are connected to, that have a heart to help and have a heart for the seniors, to get what they need done, especially when you are working, a child or a working person that's caring for a senior. It's very, very hard to pull away from work to meet some of these needs. So that's where Bethesda Holistic Center comes in at, and the home care agencies that we love to work with fill in that gap to help you. Okay, so we text each other, we call each other. Communication is key. So again, we need you to come up with a plan in caring for your loved one, especially if you're in a situation that you're not happy with. Now, even though like these companies that we work with, we even have people that have some situations that they're not satisfied with, and I will handle that situation personally. I mean, that's just what I do. So I'll listen to what the family have to say, listen to what the patient has to say. I have to be an advocate for the family and the patient. So we really try to work together to get the situations resolved and get what is needed and to get things done that need to be done. Okay. So I just want you to know that it's very, very important that you have a plan when you're caring for whomever. So again, number one, have a plan, have a budget. Number two, know the resources that are available to you. There's a lot of resources that are available to people that are free. Meals on Wheels. How do you get connected to Meals on Wheels? You'll be surprised and amazed at how many people heard of Meals on Wheels but don't know how to get connected, don't know how to get those services rendered, because when people get to a certain age, it's not safe for them to cook for themselves, or they don't have the dexterity to do it anymore. And sometimes it's very hard for family members to do the shopping, do the cooking, bring the food, or be in the house with them. So Meals and Wheels is very, very important. Hey, Gwendolyn. Hey, Mona. Thank you for joining on. Please like, invite, and share as you guys come on. Hey, Phyllis. Thank you, Phyllis. Thank you. Hey, Beverly Grant. Hey, DeQuinder. How are you? Nurse practitioner. Hey, Larry Smith. Hey, hello, everyone. Thank you for joining on. Hey, Charlisa, thank you for joining on. So we really take our time out to do that. We even draw blood. We have a new lab technician. Hey, Charlisa, who has come in that actually goes house to house collecting urine toxicologies. Because we do have people that are on pain medications. She goes into the homes to collect urine or oral swabs and draw blood as needed, okay? And she can be in the home and be in my eyes too, as well. She's like, well, Dr. Grace, even though I'm in the house doing labs, the patient said this and this and that. Could you give them a call, or could you get them on the schedule for you to come out to make a visit? So we are very dedicated to the patient population and demographics of people that we service. Okay, it is very, very important that you understand that and know that. So even on the concierge side, those are the people that we service that don't have insurance but they pay cash money for our services. You need to have a plan. You need to have a plan for yourself. You need to have what you want to do if you can't speak for yourself. Who's going to be the power of the attorney for medical decisions? Who's going to be the power of the attorney to pay your bills and do your finances? What are your advance directives? Do you want CPR or you don't want CPR? Those are the things that you need to talk about and have in place, okay? It is very, very important that you do that. It's very, very important that you let family members know what your choices and what your decisions are. And once we get that documented and on paper, it's my job to be the advocate for you if you can't speak to yourself, to relate to the family and show them the paperwork and the documentation. This is what he or she wants done and not done. Because most oftentimes those things are not in place. And then you have this family feud going on along with some of the other stuff that is going on too. So because you have everybody who wants at this time, this is, I see it all the time. The main one that's doing all the work, right? While the person is, alive and well and talking for themselves, the main person that's doing all the work, when the person can't speak for themselves in the ICU, then you have all this family coming out of the woodwork saying they want to do this, they want that done, Where were you when I was wiping Auntie Orange butt? Let's just be real. Where were you when Auntie Orange was throwing up all over the place? Where were you when Auntie Orange needed something to eat and you wouldn't even go grocery shopping, or you wouldn't even answer the text or the call? Okay, so we see this. So you need to have documentations and things in place to have it done. And we have resources for you and available for you to get it done. And I'm so excited about that. And just me even talking about it, sometimes it amazes me myself to know this is the service that we provide. And it's very humbling to know that this is something that we do every day on a day-to-day basis. And so if you're someone under the sound of my voice, again, from the concierge service and to those who are seniors and sick and shut in and disabled, You have to have a plan. So it is very, very important that you get that stuff in. We've had those talks. You know, we have family nights and stuff like that. They get mad at me because this is supposed to be a fun time, but that's the only time our families are together. So I make my family talk about that. If something happened to you, what do you want us to do? You know, we have one family member who don't want a blood transfusion. You may have another family member who said, I want everything done. If I'm on tubes and tubes up my nose, down my throat, and all that. Let me stay on there until God do a miracle or whatever. Some people like, look, I don't want to be hooked up to nothing. You know, if that is what they say, and there's no brain activity, disconnect me. So you know, I force my family to have those conversations, so we kind of know where we are and what we want and what we don't want. So it won't be any scrambling or disagreements or arguing during the time of dealing with those type of situations if it arises. So let me be clear on that. I want to be careful with my words because you know I am looking for myself to just when the time comes, death, where's your sting? I just want to be. This is what I would love. How I would like to go home to be with the Lord when He calls me. I would love, like this one story I had this one builder years ago who says that her aunt, that she was like in her 90s or something, and she would go to worship service. She would come home, take off her dress, but she would have her slip on. She would cook her meal, eat her meal, sit in her lazy boy and watch TV. So when they found her in her lazy boy, made her transition to be on home with the Lord, it was after Sunday worship because she was still in her slip and everything. So she wasn't on any medication or anything. She wasn't sick or anything like that. She just went to worship service, went home, had dinner, watched TV on her lazy boy, and closed her eyes and just went on and home maybe with the Lord. So I want to say this: you don't have to fear death. You don't have to just to talk about it because we are promised that death doesn't have a sting. All right, it doesn't have to. You don't have to have die of a heart. Well, what I should say, a massive heart attack, something painful or whatever. It doesn't have to be that way. But anyway, but you have to have the discussion and the talk with your family, just in case there is some type of illness or ailment and you can't speak for yourself because your life can be changed within an instant. Because I also do all the cases and I see people's lives change when where they're active and doing a lot of things, and then the accident, they have to go through this process of road of recovery. So, hey Doris Eads, thank you for joining on. Thank you for joining on. It is very, hey Gwendolyn, I think I said hello to you. Was that Gwendolyn? Oh yeah. So it's very, very important that you have these conversations because I think I've said this before on another show. You got to remember that death has been removed out of our daily lives, which means of course you hear about family members passing, or you see it on the news, you see it on Facebook, so and so passed or whatever. But before that, people used to die at home. People didn't die in the hospital. People didn't die in rehab centers. People died at home. I mean, it was just part of life, and even part of our preparing and eating our food. We killed animals to eat. I mean, that's just a whole part of that, but everything has been removed from us. So, you know, everything is killed for us, processed for us, and all that other kind of stuff. So, death has been removed from our day to day activities. So, people don't talk about it, but death is a part of life. And death is only the gateway to eternity. It is what it is. So, we are in this body, but our souls is what it will continue to live. Our soul and our spirit is what continues on. But our bodies house us while we're on this side of heaven, or this side wherever you're going to be, I should say. But anyway, that's a whole nother story. But you need to have a plan for your later years on where you're going to live. Like I said, you got to have a plan. You got to be putting money away for that. You just got to have a plan, especially if you're planning to help your family. You know, as they mature, grow, whatever. If you say, I want to take care of my mother, or I want to make sure my parents live with me, what is your plan for that? Okay. So everyone is not going to have a pension. Everyone is not, we don't even know when we get to where we need to retire if there is going to be a Medicare. We don't know if there's going to be any type of government, um, how should I say it? Government help, and at the end, we don't know. It is what it is. Medicare. We don't know if it's going to be Medicare for health coverage. We don't know that. We don't know if it's going to be Social Security disability benefits. We do not know. Based upon how things are going politically. So you guys have to make a plan. And I say this wholeheartedly. If you need to take care of yourself, you need to take care of your health. Okay, you need to take care of yourself now. You millennials that are out there, hopefully people are looking at this video. You millennials, okay, you're young now, but you need to make good choices now in regards to your health. Don't have the attitude, I have the rest of my life ahead of me, because they make it real easy to be unhealthy at a very early age. So you can't be doing fast food all the time. You can't be eating junk food all the time. You need to be eating your fruits and vegetables and drinking your water now. You need to be exercising now. You shouldn't wait until something breaks until you fix it. You need to be preventative in your health and your maintenance now. So it is very, very important that you do that, because we don't know as financially, as far as insurance or whatever the case may be, that'll be for available when you turn 65. They're talking about making 65 a little later, maybe 70. We don't know. So you need to start taking care of yourself now. Health care is very affordable, because we spend money on what we want to spend money on. Even in the concierge services part, where people that don't have insurance, we're not asking you to spend money that you don't have. We're asking you to redirect your dollars and to put in your budget a plan that is inclusive in taking care of your health. Entrepreneurs are, how can I say this? Entrepreneurs are very good at not putting a budget in their budget line, something for their health, because commercial insurance can be a little bit can be expensive with a high deductible. That has changed with this new, um, what is the word I'm looking for, with this new, the people that are in office right now. So they got rid of those high premiums and high deductibles. So you really need to go back and revisit the Affordable Care Act, better known as Obamacare. You really need to revisit that, or look at our concierge service piece. You really need to look at that, because we have companies that are using our concierge in lieu of the commercial insurance, because not only are they getting a low monthly premium, they have personal access to a doctor, via text, texting, emailing, video chat, and they, at Bethesda, we pride ourselves on the fact that we do a lot of stuff holistically. Okay, I had a situation recently where it was the whole office, everybody high blood pressure. Okay, but you need your office, your team to function. So they were able to get in touch with me and say, hey, what do we need to do? And so we need to get the blood pressure immediately under control while they're on the blood pressure medication. We are looking at lab work, blood work, and things that are deficient, so we can supplement and get them on natural, and then we're going to wean them off the blood pressure medication, because it was 3 digits over 3 digits, and they can't walk around like that. They just can't, because they are at risk of stroke, heart disease, renal failure. So we have to use acute measures for acute situations. Okay, so if you're someone under the sound of my voice, you work for yourself, you're a 1099, you're a contractor, or whatever the case may be, you in your budget should have a budget line for healthcare costs for you. Be it a supplement, be it whatever the case may be, it concierge, be it whatever the case may be, you have to budget for it. Because if you get ill or something happens to you, okay, you are the money generator. So when you stop, the flow stop, unless you got 6 other streams of income coming in, be it passive. Okay. And so, but you need to be in position to develop and cultivate even the passive income. Okay. So until you get to that point, so you have to have a plan in regards to that. Even disability insurance, it's very very important that you have that. Okay, because if you do have to stop, you want to be able to tap into that until you get back on your feet or get back into a situation health wise to where you can get back to generating the revenue. So it's very, very important that you do that, that you have that, okay? So I know we were talking about how to take care of aging loved ones, but we kind of like went down this real road a little bit. So if you're an entrepreneur and you're looking at and taking care of aging loved one, again, you have to budget for that. It has to be in your plan for that in regards to what services that you're going to provide for yourself so you can stay healthy, so you could take care of the aging loved one, okay? So that is very, very important that you look into that and have a budget for it. You have to have a budget for it. You have to have, let me use another word instead of budget. You have to direct your dollars, give your dollars an assignment for that, for health care coverage costs for caring for a loved one. Okay, so now you have to have that conversation with that aging loved one. Say, hey, Auntie Orange, Mama Orange, or Daddy Banana, whatever. I'm just making up names here. What is it that you want to do? How do you want to live you know, in your later life? How do you want to do this, that, and the other? You have to have those conversations, and it's good that you have a medical practitioner to hear you talk about that. So for you practitioners that I paid $600 a month when I was self-employed, nothing was covered. Of course, nothing was covered. Nothing was covered at all. So, and then that $600 a month didn't even go towards the deductible. So, if you had to go to the doctor, or if you had to go to urgent care, if you had to pay for your medications, if you had to do whatever, you still had to come cash out of your pocket because that deductible wasn't met. And most oftentimes, that deductible was anywhere from $3,000 to $7,000, which is crazy. So again, that's where concierge come in at. It's very, very important that you look into that. I'm not trying to be funny, DeQuinder. Me and you need to talk about being concierge for one another. How about that? I concierge you, you concierge me. We got to figure that out because you know most oftentimes as medical professionals we treat ourselves, but it's always good to have an objective point of view because you know doctors and providers make the worst patients, they say, to make us hold to what we need to do to be true to ourselves and be disciplined in the areas in regards to our health. So we definitely need to have a conversation about that, DeQuinder. When the next time we get together, we need to have a conversation about that because it's very, very important that we do that. But anyway, you definitely need to do that. And DeQuinder, other providers, your nurse practitioners out there, physician assistants out there, you need to have a talk with your patients in regards to what they want to do. If something major or intensive happens to them, that conversation needs to be made. Okay, and then once you have that conversation with that patient or whatever the case may be, then you need to convey that information to the family. And then as a provider, for that patient themselves, if they have caregivers, all of that you need to that's called coordination of care. So you need to coordinate that care. You need to talk about it because that's very, very important in what we're doing as doctors. We're just not saying, oh, this hurt, here's a script, here you go for that. We really need to work together as a team to coordinate the efforts to make sure people have longevity and not only have longevity, just the sake to say that you live for a long time. You want to have a productive, healthy lifespan in your right mind, the activity of your limbs, being able to walk, being able to remember so and so and all of that. And so it happens right now. It starts today. So if you're a provider under DeQuinder, your deductible was 5,000. I told you anywhere from 3,000 to 7,000. So But anyway, so if you're anyone that's under the sound of my voice, even if you're a provider, even your nurse practitioner, physician assistant, if you want to get with me, because we're going to start having classes soon, um, where we're going to be discussing with you how to, how to do that, when to do it, when is the best time to do it. And then in certain cases, for certain services, you can bill for it. So what are those codes? What do you do in regards to that? So we can have Jaquinda, you might want to, you and I, we need to talk about that too, getting some nurse practitioners together so we can, so I can educate you guys on that, especially you entrepreneurs that are working for yourselves, or even if you're working for a company, you can take this information as and take it back to wherever you're working, because when you bring in more revenue, right, it's good for everyone. So it's a win-win. Most of the time when I get on here, it's a win-win. It's good for the patient, it's good for the provider. So we really need to get together. Hey Regina, thank you for joining on. Regina Butler, thank you for joining on. Like, invite, and share as you guys come on, because it's very, very important that we understand that taking care of a aging loved one is mentally, physically, and emotionally taxing. So the person that is providing that care has to take care of themselves too. I have to have this conversation a lot. Could you please get some help? And then most oftentimes, again, like I said, it just falls on one person. So when a person is getting progressively older, or their dementia is getting worse, they're becoming combative or things like that, it needs to be reassessed. Hospice care. Let's talk about hospice for a minute. Hospice, um, through the decades, have been getting a bad rep because most people think hospice means that you've given up and that this person is about to make their transition and they're about to die. Hospice now, it can be for a whole myriad of things, especially when it comes to dementia. It can provide the respite care that the caregiver needs. Respite means they need a break, they need to get away. So, what hospice can do is come in and make an assessment to see if this person meets the criteria for hospice dementia or whatever, Alzheimer's or whatever the case may be. And if they meet that criteria, there it increases the level of services that is provided for that patient, along with respite services for the caregiver. Okay, because it is a lot dealing with someone that has dementia. It is a lot dealing with someone that has Alzheimer's. And I use those terms differently because they are two different things. It is, they call it Alzheimer's dementia, but there's also dementia, which is what, guys? Vascular dementia, or it can be a combination. You can have combination too. So you have to know when to make that assessment. I get text messages and calls all the time that a demented patient is becoming more combative. Does that mean that the dementia is getting worse? Not necessarily so. So if you're a provider under the sound of my voice, dealing with the elderly, combativeness, more aggression can be an infection. Most oftentimes a urinary tract infection. So we need to treat the urinary tract infection. I don't try to collect urine. Because if they're dementia, they probably have a diaper on, and most often time, if they're combative, they're not gonna pee for you. So based on that alone, I will empirically treat, because that's very, very important. But anyway, getting back to what I was saying, you have to sometimes, how can I say this? I got a text message one time. Sometimes I don't get to my text messages as quickly as I want, and sometimes I'm thinking like I'm a little bit slow in responding, especially if I'm in the middle of my busy day. And I remember a nurse responding to me one time when I had that thought. She was like, "Dr. Grace, we really appreciate working with you because it can be days before we get in touch with a doctor or get a doctor to respond." And I'm like, "What? Who does that?" Okay, I know I'm busy, but are they really that busy where it takes days to respond? I don't know, but for me, I always try to put myself in the position. What if that was my mother? What if that was my aunt? What if that was a family member, or whatever the case may be? I would want somebody to respond to me. So, but anyway, that's just me. So, if you're a provider under the sound of my voice, please, please. Sometimes you have to go the extra mile. Sometimes you have to go beyond the call of duty. Not saying that you don't already, but it is so rewarding to get those type of um, to get back with um, a response to what you're thinking in your head, and it's like what you're doing is not really the norm. So to God be the glory on that, because I do my work as unto the Lord anyway. So we really do go beyond the call of duty here at Bethesda Holistic. It's not just me. From the people who answer the phones, the people that work with us, Phyllis, Tanisa, Essie, Charlisa, we really go beyond the call of duty, and we work together as a team. So, and we really say to ourselves, we have to make sure that we communicate better, because communicating better amongst ourselves provides a better service to those that we meet and come in contact with. So if you're someone under the sound of my voice that looking for a visiting physician practice, who is dedicated to the call and to the task of providing services, we are the practice for you. If you're someone under the sound of my voice who is an entrepreneur, and you just can't afford the commercial insurance, you need concierge services. Or you're someone who is a working person and they only have you part time, so they won't have to give you medical insurance, and if you did pay out of your pocket, it still costs you too much. Concierge might be the thing for you, because we even have connections and with different programs. If you need medications, where you can pay $4 for a prescription, $5 per prescription, $10 for a 90-day supply for pharmaceuticals, if that be the case. Of course, supplements and things of that nature, you got to pay for that anyway. But we pride ourselves on making it affordable for you to take care of yourself. You have to take care of yourself now, because take, believe it or not, preventative is better than a hospital stay. Let me say that again. Doing the little stuff that you need to do now, eating right, supplementing yourself, me calling us for concierge services is a lot cheaper than doing nothing and winding up in the hospital, and that you have to pay like anywhere from $75 to $80 for a Tylenol. Yes. Mm-hmm. Yes. So it's best to do it on this side of healthiness, or right. Let's do it now. So again, I appreciate you guys tuning in. It is 8:56. Again, I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center and Everything New Medical Care, with alternative services, where we bring the doctor's office to you. Where we will help you not only, like I said, health mapping again, where you are now and where do you want to be in regards to your health, and how do you want to live your latter days and latter years. And if you're someone that's caring for a loved one and you want to come up with a plan on how to care for them in your home, or finding placement, or what resources are available to them, call our office. Call our office, make an appointment, do a consultation. It is worth it. It is worth you calling us to find out what you need to do. We help you with the plan. We help you to decide and tell you what paperwork that you need to have done and how to get it done. Power of attorney or medical power of attorney, how to get that stuff done. Okay. There are some resources that are available to you to get that stuff done based upon income. Okay, so we can get you connected on how to do that. So you need to call us. That's the only way that you're going to find out, is 248-356-1111, 248-356-1111. Our website is www.bw-center.com. That's www.bw-center.com is our website.
Again, our telephone number is 248 356 1111. That's 248 356 1111. So you guys give us a call. And if you're someone under the sound of my voice and you are our patient and this is something that you want to have done, just call us and say, hey, Dr. Grace, you haven't done my advanced directives with me yet. Or you haven't done our advanced directives with our family yet. This is something that we're interested in doing. Is there any other services that my family might need? I might need a social worker. So we can get an agency in a home and get a social worker in to help you to assess and address those the concerns that you have in regards to that. So we are here to serve you. The greatest among us is a servant to many. So to God be the glory for the greatness that is within us through Bethesda Holistic Center by providing service. So we want you. Oh, thank you, DeQuinda, for posting that telephone number. I appreciate you. I appreciate you. I appreciate you. So please give us a call so we can help you. I mean, I've had a patient who was dealing with high blood pressure and dealing with a whole bunch of stuff because she was taking care of a dying a loved one. I was able to help her on both sides. I was able to tell her what she needed to do to care for the loved one that was making their transition, and by her being my by me being able to give her the information that she needed, help her stress level, which helped me manage her blood pressure even better. So it is very, very important that you understand what you're dealing with, who you're dealing with, and what's the best way to deal with it. So we at Bethesda Holistic Center, we provide that. So please, please, please give us a call if there's something that you're interested in. We're looking for new patients to go into their homes. Definitely looking for new concierge services. And so if this is something that you're interested in, and if you're a provider under the sound of my voice who want to be educated in this, who want to be trained in this, you need to give us a call so we can set up a time to let you know when the classes will be available, or even on one-on-one, because I know being a provider is kind of hard to carve out time to do that. So we can even do it on a one-on-one basis based upon your availability and mine. So I really do appreciate you guys for tuning in tonight. I'm Dr. Grace Patterson, managing on the Bethesda Holistic Center and Everything New Alternative Medical Services. I'm going to be studying for the second half of my anti-aging boards, which will be coming up in May. I'm so excited about that. So keep me in your prayers in regards to that. I'm believing God to be a business owner and not a business operator. Two different things. Yes, it's two different things, being a business owner or a business operator. So I want to be able to pull away to do other things, as far as teaching is concerned, developing another business, and developing more passive income, so I can do more things, so I can do more kingdom business, so I can do more traveling, so I can spend more time with my family and spend more time with my patients. I want to see patients because I want to, not because I have to. And so I am so excited. I'm so excited. I'm so excited. So Larry can't write that fast. Okay, Larry is right there. The telephone number 248-356-1111, and the website. So thank you all for tuning in. It is 9:01. We're gonna if you want to talk, if you want to send me over something else that you want to talk about next week. I was thinking about doing. I had a thought. I can't remember what I said. That would be a good topic. But I had a topic for next week, but it escapes my mind right now. I gotta bring it back. But if there's anything else that you guys want to talk about in regards to a topic or anything like that, I am more than willing to address different topics. If it's a particular topic that you want me to discuss and to research before next Monday, I am more than willing to do so. So again, thank you for tuning in to Medical Monday. Until next week, until next Monday, I will see you guys. Now, I have a vacation that will be coming up. I think I will still be here. No, even though I'm going to be on vacation, I think I will be here the Monday before and the Monday after. So, but anyway, so there'll still be Medical Monday. So I appreciate you guys, and I wouldn't be able to do what I do without you. So I just want to say I appreciate you. So please share this a couple of times, because Facebook and all these other modalities have really have limited our reach, because of financial reasons. So we really need you to share more than once. So you might have to share a couple of times. So we're also on Instagram. We're also on YouTube. So please go to Medical Monday Grace Patterson and subscribe. And please invite your friends to subscribe. And there's a whole myriad of videos that are over there that you can peruse through, if to get some things answered that you might want to get answered. So I appreciate you guys. Grace and peace. God bless. Bye for now. Until next time.